This is Dr. Sargisian, and today we'll talk about alternations in musculoskeletal function. To start the overview of the musculoskeletal disorders, first of all, we need to talk about fractures, dislocations, sprains, strains, trauma in general. The reason we would like to talk about it first and we pay so much attention to it because it's quite common, and unfortunately it's still the leading cause of death of young people, and here's the data showing that leading cause of death of people ages from 1 to 44-year-old, and it's the trauma injury doesn't discriminate. All races, socioeconomic levels, the national origin doesn't matter. Trauma is still the leading cause of death for this age group. So another important issue is alternations in bones, joints, and muscles, and these are disorders that really do not caused by external factors such as trauma and musculoskeletal injuries, but they are caused by internal factor like distorted metabolism, infections. Also, infection also can be, of course, external factor, and autoimmune, inflammatory, non-inflammatory diseases, and also malignancies and tumors, non-malignant tumors. So when we talk about fracture, we would like to give a definition. Fracture is a break in the continuity of the bone, and it doesn't mean that bone is completely broken, there is complete detachment. Break means it can be like a green stick fracture, part of the bone still attached together, but there is some type of crack, some type of break, some type of distortion, disruption of continuity of the bone. So what I'm trying to say, if they say they diagnosed with a cracked bone, actually the cracked bone, colloquially said, means still a fracture, incomplete fracture. So fracture will occur when force is applied, then which will exceed the tensile or compressive strength of the bone. Tensile, basically the tension or compression that bone cannot sustain. And bones are very strong. However, you may notice that elderly people may develop fractures more often than younger, and the causes may be quite benign, like quite simple falling on the floor may result in femoral fracture, while younger person, athletes, or even non-athletes can sustain numerous falls and be fine and have no trauma. But again, this can be contributed to osteoporosis and other effects of aging. But again, the break will occur when the force exceeds the compressive strength of the bones, or so the tension applied is more than this bone can sustain. And again, different ages will have different strength in the bone, different ability to sustain the trauma. Fractures can be classified in number of ways, and you can classify them as the condition, but based on the condition of overlying skin. So closed or open, so complete or incomplete. So closed or open. Closed fracture is when there is no visible bone puncturing the skin. If the bone protruding through the skin, or there is an object that has punctured the skin, making an opening through the skin and hitting the fracture site, it's an open fracture. Open fracture, again, it's not just the bone coming out, but there is communication with outside world of the bone. Open fractures also can be called compound fractures, because not only the fracture, but there is also open skin. The skin isn't intact anymore, so this is compounding the fracture. So this is compounding the fracture. Complete fracture, if the fracture goes completely through the bone, and incomplete is the case when bone is not basically fractured into. There is still some connection between the parts of the bone. So if there are more than two ends of the fragments, the break is called comminuted fracture. If bone is somehow sustained quite a nice clear-cut break, it may be called linear fracture, and oblique fracture run in transverse pattern. Spiral fracture will twist around the bone, and spiral fracture, for those of you working in emergency department, certainly this is rather disturbing sign if found on the underage or infant or toddler. Means most all the time this means there is some kind of child abuse going on. So to continue fracture classifications, we can differentiate between the location of the fracture and how the actual fracture or the crack goes through. So transfer fracture, it's quite straightforward. It goes across the bone and it goes almost at 90-degree angle, and it's in contrast to longitudinal fracture that runs through the length of the bone. So another type of fracture is green stick fracture, or you may call it torus fracture. And green stick fracture, it's incomplete bone break, and bowing, it's just bowing of the bone without visible breaks. But in both places, some kind of cracks and changes occur. And torus fracture is a classic green stick fracture with incomplete break. Usually occurs in children because children have soft, non-completely calcified bones, so it's much more difficult to break the bone completely and cause a transverse fracture. So pathologic fractures are usually related to some pathologic process, which may include hypercalcemia. For some reason the calcium is stolen from the bones, and it's in the and it can be the deficiencies of vitamins such as vitamin D versus parathyroid hormone insufficiency or overproduction. So pathologic structure has some other underlying cause, and this is not related to bone per se. And of course, cancers and tumors may cause pathologic structure. Stress fractures are interesting class of fractures which are occurring with repetitive use. And with repetitive use, what will happen, the repetitive use will create tiny cracks in the bone. Before we move on to different type of fracture illustrations, let's talk about transchondrial fracture is a type of a stress fracture. It's a fracture of the articular surface of the bone, and it will be produced by some type of force transmitted from the articular surface of a bone across the joint and through the articular cartilage and to the subchondrial trabecula of the fractured bone. So basically it's a transchondrial fracture, and it's transferred to the articular cartilage to subchondrial trabecula of the fractured bone. So this picture has numerous, well, several pictures of different fractures, and has oblique, occult, hidden fracture. You can see it's pointing on the hidden spot. Has open fracture. Again, open fractures are important physiological or pathophysiological phenomenon because the continuity of the skin is disturbed and there is an open access to the bone which of the pathologic organism, which can cause, of course, osteomyelitis if it's not treated rapidly. Pathologic fracture, you can see some type of tumor or degeneration of the bone occurred, and you can see the femoral head, it's almost detached or getting ready to be detached. Segmented, a segment of the bone is present, and the more segments you have in the fracture, the more difficult to repair it, but fortunately nowadays with the technology of having open reduction and internal fixation, even complicated fractures like this can be repaired. Spiral fracture, again, transverse, green stick, and impacted fracture is one of the most difficult types of fracture, and usually, again, the femoral head will be affected. In, let's say, 70, 80 years ago or earlier, this may meant that the person with this type of fracture will be bedbound or will be severely handicapped and not able to move, or mobility will be severely affected. Fortunately nowadays this is possible to treat, and usually what it will result in a partial or total hip replacement, most likely total hip replacement, and patient will have a sufficient degree of mobility, which often neglected from telling the patient, which often the healthcare provider neglect to tell patient, and I don't like to use neglect in this context, or forget to tell the patients that even with the most advanced techniques and technology in orthopedics procedures, the initial or baseline degree of mobility may not be achieved. So people have, especially in elective surgeries such as knee replacement and hip replacement, people may have unrealistic expectations of being to return to their first, to their baseline level of mobility very fast. Again, sometimes it's possible to achieve your baseline level of mobility, but it may take months of physical therapy and months of returning to activity level that patient previously had. Another issue we have with bone fractures, it's the damage to surrounding tissues, and periosteum, blood vessels, and cortex and bone marrow can sustain damage. When this happens, again, hematoma formation may happen, and also inflammatory response will happen, but this may result in procallus formation and not healing correctly. So the bone or the fracture needs to be set correctly with the help of cast, splint, or even again surgical procedures such as again ORIF, open reduction, internal fixation. Patients with bone fractures may present with unnatural alignment, lots of edema, swelling, muscle spasms, tenderness, pain, impaired sensation. And impaired sensation is one of the consequences of nerve compression, and that's the consequence of edema or trauma to the nerve from the broken bone. So treatment to bone fracture may involve the manipulation, closed manipulation, basically aligning the bone and putting it in the cast, putting the extremity in the cast, or putting some type of splint, putting patient in tractions when the bones are severely misaligned, or we need to pull them apart because they touch each other in the manner that the union will be resulting in inappropriate angle. And another option which works very well is open reduction, creating an incision and fixating the bone with some type of internal device such as pins or plates or screws or rods. But open reduction guarantees fast results, of course, and it also may result in quicker recovery time and improved functionality after the surgery. If the reduction is improper, the complications may occur, such as non-union, delayed union, and malunion. All these complications may result in severe impairment of mobility and severe reduction of the quality of life of the patient. When non-union occurs, the edges of the bone, they fail to grow together. So there is a gap between broken ends of the bone, which will fill with fibrous and cartilaginous tissue, and the gap will not really be functional to take any pressure, any force, sustain any weight. And also there may be sac, fluid-filled sac space that may create a pseudojoint or pseudoarthrosis or false joint. Basically, the fiber will be created and the fluid, like synovial fluid, will fill the space. And of course, this is not a joint, and it can function by no way or shape, and it only will complicate the issue. Malunion is growing into a type of when the bone unites, but it unites at the angle that it's inappropriate for further functioning or sustaining mobility. And delayed union, it's delayed union of the bone when the time of the union of the bone takes much longer than usually. This is a traction device, and sometime this may be used for improving the length of the extremity where patient has a congenital defect or disorders when one extremity is shorter than the other. This type of traction device with pins may be used. again, I won't be too redundant. I keep emphasizing and repeating that in this type of traction device that involves pins, very important for the device to be successful and the whole procedure and outcome will be successful, the pin care and keeping the edges of the pins clean. So although we are trying to make the bone better and or fix the fracture or create extra length in the bone, at the same time we may be putting patient at risk for infection. So again, the pin care is very important, and it should be addressed by nursing staff very diligently. Dislocation and subluxation are displacements of the bones, but in case of dislocation, it's a displacement and loss of contact between articular cartilage, between articular surfaces, and in subluxation the contact is only partially lost. So dislocation, subluxation can occur with fracture, muscle imbalance, joint instability related to rheumatoid arthritis. Anything else they can make joints more or less lax, but trauma, fall, excessive force, especially on someone who otherwise have strong bones and not prone to fractures, may cause dislocation. In this picture, this is actually a relatively recent picture. A couple of weeks ago, it's one of my friends who was participating in biking and was actually sustained a trauma to his ring finger, and you can see that this picture taken in emergency room, and still the patient has still biking shorts on, and that's a trauma to ring finger, and it doesn't look that bad in here, and there's some mild, you would say, at least looking at this picture, edema. However, when you look on the X-ray of the picture of the hand, you see how dramatic is the actual dislocation. It's complete dislocation of the joint in his picture. You can see this picture has an image of his wedding band, but you would see that basically the bone is completely dislocated, and there is no touching of articular cartilage in any of the bones. Fortunately, they were able to set this back in, and he's doing very well, and the pain is gone and the swelling is gone. But this very dramatic presentation, you can see, is the view is lateral of the finger versus posterior on the photograph, but X-ray view is lateral of the finger, and you can see the significant amount of swelling, and you can see also the swelling that goes around the ring, and they were able to set this down without even cutting the ring off. Although if it was getting more edema, it would have been probably highly advisable to cut the ring off. I don't know what his wife would have said to that, but it could have been the course of events. This is a stock picture from the book, and it shows the subluxation of the thumb, and you see that there is some touching between articular surfaces, and there is not much going on, but this is possibly a result of rheumatoid arthritis. and there is really not much can be done. It's probably can be set back, but because of the condition the patient in, the subluxation may occur in the future. Support structure injuries include sprain, strains, and avulsions. And strain is a tear or injury to a tendon, and sprain is a tear or injury to a ligament. Sometimes they used interchangeably, especially by laymen. Colloquially, you will see that people would use strain or sprain together. Sometimes even diagnostically it can be said that patient has strain or sprain. Avulsion is complete separation of the tendon or ligament, and from wherever on the bone it's attached. So strain is truly one of the most common injuries, and it's one of the reasons is overstretching injury of the muscles. So for instance, patient may have a lumbar strain from lifting too much weight, inappropriate lifting techniques, or repetitive lifting. And backs are the most common strain back, most common weekend or after the weekend injury. You go to Lowe's and they advertise, oh, you can do this project over your weekend. You may do your project, but again, don't forget that proper lifting technique and proper technique of working with power tools are important. And sprain is again the tearing of the ligament, and complete sprain or complete tear will be avulsion. So what happens in this case? Sprain may happen most commonly with sport activities, with the intense overloading of the joint, intense overloading of the ligament. The ankle joint is most commonly affected, and the pain can be unbearable to the point that, of course, the ankle cannot be used. And here we're going back to the discussion regarding the pain, or that pain is actually a protective mechanism of some sort that prevents the use of affected extremity or body part, and it may facilitate the healing. So if patient experiencing a sprain, there may be swelling, pain, erythema, and even some ecchymosis, were because of the damage to the capillaries which are hemorrhaging around the area of the sprain. X-rays may be taken in this case when patient presents with these signs and symptoms. However, X-ray isn't taken in this case to make a diagnosis. X-ray is taken to rule out a fracture. So basically, sprain will be a diagnosis of exclusion. If for some reason, if there is a suspicion for something else or complicated sprain, the MRI may be ordered, or even an arthroscopy. Although if arthroscopy is done, most likely some type of repair procedure will be performed. So sprains and strains can be treated, especially when they are mild, by using the RICE principle: rest, ice, compression, and elevation. So compression, it's always ACE bandage, and all of these intervention may be of benefit, and they benefit the patient by really reducing or eliminating the use of the affected ligament and resulting in healing. In severe cases, the surgical intervention will be indicated. But again, from primary care perspective, important thing is to evaluate for fracture if patient presents with sprain, because the presentation will be fairly similar, or if not the same, because edema, pain, and ecchymosis, patient will have tenderness on touch, so it's all the same. So really truly x-ray, and if it's not severe sprain, if patient somewhat functional in the extremity, then Rice principles may be applied. If not, if there is a suspicion for complete avulsion, then a referral to orthopedics or the emergency services for further evaluation and treatment.